Hello, social workers, mental health professionals, and change agents. Welcome to another episode of season 7 of the Social Work Branch podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. I appreciate all the love and support. Gracias a todos por su apoyo. Continue to follow the podcast on all social media platforms. Follow the podcast on Instagram at the Social Work Branch Podcast. And as of this recording, follow the podcast on X or Twitter, whatever the platform that Elon overpaid for, whatever it wants to be called. By the time this podcast airs, it's going to probably be another name, but um, follow the podcast on the social media platform formerly known as Twitter at Social Work Rants. Follow the podcast on Facebook. Type in the Social Work Rants podcast. Hit that like button. Of course, the YouTube channel. Hit that red subscribe button. If there's a video you like, I'm almost at 100 videos on the YouTube channel. So a lot of incredible social workers that I've interviewed. Uh, Hit that like button on the videos, comment on the videos that you like, share them. Let's get this word out because there's a lot of great social workers out, not only in the U.S. or outside of the U.S. as well, doing amazing work in the field, and clients are really struggling all over the place. Yes, disclaimer: this podcast is for educational and entertainment purposes only. It is not to be used as a substitute for individual therapy. If you need assistance, please call 988. If you have a therapist, contact your therapist. If you have a psychiatrist, contact your psychiatrist. If you need to call 911, call 911. Go to the nearest emergency room. For those who listen, or my listeners and followers out of the country, whatever your emergency phone number is, please use that number to contact, get the help that you need. Is okay, not to be okay, but definitely get the help that you need. That being said, um, I continue to educate my viewers and listeners about the power of networking, especially through social media. And my guest at this time, Kirsten Jacobson, we met on Twitter. He's from Utah, so I can cross Utah off my states of interviewing social workers from. Um, we're going to be talking about EDMR today. Just know, I know that's been kind of popular. I've seen on social media channels. I don't know too much about it, so I can get some education on today. Kirsten, how you doing today?
Good. Welcome to Utah.
Thank you. Besides Mr. Romney and the Utah Jazz, I don't know anything about Utah.
Yeah. Well, those are like the two most popular things out here, I think.
Yeah,
Yep.
guess so. Well, no, we no, met on Twitter, whatever Elon wants to call it,
Yeah.
and kind of sent out the tweet out. I think it's probably been like most popular tweet I've sent on the podcast. Like, hey, I'm looking for a podcast guest for season 7, and it just blew up. So like, Kirsten was gracious enough to respond, and emails back and forth, and here we are making it happen. So definitely always been stressing since day one of the podcast to shoot your shot, especially in this, during the COVID era and now this post-COVID era. You just never know. Don't need to make connections now that everything's kind of back opened up, and meet people in person, or people that you met on social media and meet them in person, and that little like starstruck, oh snap, I know you're from social media. So it's like um that's been happening for me recently. So Kirsten, for people who don't know who you are, what you do, let uh fellow viewers and listeners know who you are and what you do now. Wonderful challenging field of social work.
Yeah. So my name's Kirsten Jacobson. I am a licensed clinical social worker. That's what it's called in Utah. I own a private practice out here, and I've co-founded um, a business called Education Empowered. And in the private practice, I treat adults and children who have experienced trauma through the use of EMDR. And in Education Empowered, we work with families to help them, families whose kids have these invisible disabilities, get their 504s and their IEPs for school set up.
Oh,
So,
nice. That is
yeah.
very, very important considering, depending what state you're in, school in America is literally right around the corner. So,
Yep. Yep. Ours is a couple of weeks away.
wow, a couple weeks away.
Yep.
That's ins- that's insane.
Yeah.
um, yeah. So for people who don't know what EDMR is, like I said, I've seen it. I know people who are doing it, but for those who don't know what that is and how does that work, relate to clients, well, can you give a little,
Yeah.
I guess, what
Yeah.
that is?
So the long version is eye movement desensitization and reprocessing. And we utilize eye movement or bilateral stimulation, side to side movement to help people process their past traumas
Mhm.
in order to kind of resolve what's happening in the present so that moving forward in the future, they can move forward with just the freedom of letting this trauma go.
Wow, that's interesting. How would that work in terms of different cultures? I know there's a lot of some cultures that don't like if you look somebody in the eye that's being disrespectful, or just shame, or just somebody really had like a really bad traumatic experience that they can't look at somebody, like they'll listen to you, they'll follow commands or what you're saying, and they'll
Mm-hmm.
respond to you. But somebody who really has like bad eye, or who can't do the eye contact, how do you deal with that?
Yeah, that's a really good question. So EMDR is a manualized treatment, which means we follow scripts. And I have a book that's like this thick, full of prompts.
Hmm.
And the idea of the prompts is it becomes a choose your own adventure. So that's actually really common too with my kids that maybe have autism,
Hmm.
and so they experience the world really different than I do. It same as other cultural backgrounds would experience the world in a very different way that I may. And that's the cool thing about EMDR is as a clinician, I'm following their path. I'm not guiding their path, and so it allows for these differences, right? Like, and everybody experiences EMDR in a totally different way. And we're looking at reprocessing things through image, cognition, emotion, and sensation. And it could be any of those things. And so,
Hmm.
yeah, so any really EMDR sounds a lot like, hi, so take that negative cognition that we've identified. They have a list they can pick from, especially with kids.
Hmm.
We use things that are I work with kids a lot. I'll use things that are like vague, like I feel bad, I don't like myself.
Hmm.
So we'll identify something like that, and then we say, and notice that, like follow as you notice that. The cool thing is I have worked with individuals who were not they weren't able to verbalize what was happening. They knew what was happening, they were able
Right.
to kind of guide me a little bit. And my job isn't to understand. My job is just to keep it going. And okay, good. Notice that. I drop in interweaves every so often, little cognitions to make sure we're kind of on the right path. But it's really cool because that way they can experience their story. I stay out of it. I don't want to put anything in it. I want them to experience it the way that's right for them. Um, and and essentially we're gonna just start, like untwine it, like or what, picking out those knots, and getting things into that smooth place.
No, that's really fascinating. Now you mentioned IEPs and 504s. Now, how does that play into what you do with the therapy?
Yeah, so it totally informs therapy because like anyone who's worked in private practice that has had kids with like ADHD, autism, um, like sensory processing disorder, things like that. Um, and I have a disclaimer that I'm just going to put out there. My own child falls into those invisible disabilities, which has
Mhm.
guided my passion for this, right? That like she has some hearing impairment, and not everybody understands. I've become sometimes I say like social workers, like we're really like we are trained advocates.
Mhm.
So sometimes I joke, I'm like, I'm not the mom you want to mess with. Because not only am I a mama bear, but I'm also a really like trained advocate.
Right.
But how that plays in there is how I choose how we're going to do EMDR is guided by their, you know, the maybe some of these if they're if they have neuro differences, if they're neurodiverse or not. Um, like kids who maybe have ADHD or autism, using their eyes and following with their eyes just isn't as effective for them. So I made tap on their knees, so they're getting that side to side motion, crossing, we call it crossing the midline, just side to side motion. Or I have thera tappers that they hold and it goes side to side. I've even put them in socks, like one in each foot, you know, as maybe they're utilizing play.
Mm.
And so it is really important. What I think is, I wish I had gotten more training in these disabilities in school. I think I wish we had gotten. I think I wish teachers, everybody, wish we had more training on disabilities.
No, I
Um,
agree.
yeah, so that we can really, you know, like effectively help these kids or adults or any of us, right?
Mhm.
Like I think even just the way I set up my room, like I have, you can't see them, but over here I have lights. If I might dim the lights if there's some sensitivity to light. Um, the thing I like about EMDR is it can be tailored to the person. So I might dim lights, but I may not, because for some people that can bring a traumatic response to them,
Right.
right? Like if that's too vulnerable maybe for them. But for some kids who are neurodiverse, I dim lights, I change their seating. I give them something sensory, I have different pillows on my couch. I might have a soft pillow they may hold to give them some sensory to help settling things. Um, and so that's kind of where they come together. I'm like you. I've been a social worker like a long time, and so I did the math the other day. I'm like, I think it started in my first social working job in 2005,
Right.
and you know, you just like pick up things as we
Mhm.
go. I wish I had formal training on these things,
No,
but I like
absolutely.
picked up these things as we go, and you know, therapy is just not a one size fits all.
No,
You know,
absolutely.
and actually, it's like it might be the redhead in me, but sometimes I just get real ticked, and I'm like I'm there. I'm like, we're gonna get this fixed at school, right? Like it's not that hard. Like here's some things that we can do to help with that, and actually the goal with EMDR is if we can kind of settle their nervous system down a little bit, it does help our kids with like ADHD or learning disorders or whatever that might be struggling. Because now, like there's this really cool saying in EMDR, in the window of tolerance, or in that like in mindfulness would be like be when we're present, or like wise minded DBT, but in that window of tolerance new learning can take place. Outside of the window of tolerance, no new learning. So our kids that maybe are struggling and they're not getting into that middle zone, that settled zone, no new learning is taking place. So like what are they getting out of school at that point, right? We've got to get
Right.
them into that middle zone to take in all that new learning.
No, absolutely. And I like the fact that you mentioned, the indivisible disabilities that do exist, and it's more and more of those disabilities that come out to play. And I think,
Yeah.
obviously has to come. If you're a child, has to come for the pediatricians, and pediatricians and doctors need to be educated on that, so that they could train the parents, and then like you said, social workers, school employees, need to be. It's really going to take a long time as more and more of these diagnoses come into play. On Twitter, it's been a lot of advocacy regarding fetal alcohol syndrome disorder. I had
Yeah.
a whole couple podcast episodes about that, and that's something
Yeah.
that nobody really talks about that too, and I kind of see that as a possibility of a diagnosis as of like 2020 onward, because everybody was home, and
Yeah.
fortunately, liquor stores, at least when I'm originally from in New York, the liquor stores were deemed essential stores, so everybody was,
Mm.
was drinking at home. So drinking and whatever you doing at home, like I guess we'll fool around while we drink.
Yeah.
And so, but at the flip side of that, I have a lot of potential COVID babies with potential at least mild disabilities because of alcohol use. You just only time will tell with that, but like I kind of like
Yeah.
thinking ahead about that and having those conversations, and uh, I had podcast episodes about it. So, um,
Right. And I think so for social workers, we're always like connectors, right? Like,
mm,
and I'm like rah-rah social workers, but we're like, we're these people who are like generalists, right? We like know a little about a lot of things, right?
mm,
And in order to get an IEP, there's 13 disabilities that qualify for an IEP, and most of them are invisible. And
mm,
that's like autism, our hearing, our medical disabilities, things like that. And what I think is really hard is so these kids, and I was thinking about when I was coming out of college, drug addiction with
mm,
babies. So like the effects of methamphetamines
right.
on pregnancies or whatever was what was coming out, what we were learning more and more about. And yeah, and these kids, when they grow, what kind of invisible disabilities might we have, like learning disorders or language disorders or whatever. And so, as a social worker, my students, my interns that come in, I'm always like, we have to learn about these 13 diagnoses, especially because if we don't know, who does?
Right.
Like
No,
we're
exactly.
social workers, right? We're in schools, we're in homes, and if we can get the knowledge, we can get so much,
Mm.
we can disseminate so much knowledge with like the settings that we're in.
No, absolutely, and especially to educate, parents, especially parents, uh, uh, especially undocumented, clientele,
Yeah.
who, cultural plays a big, the denial of these disabilities. No, there's nothing wrong with my child, and it's having that whole education piece and aspects, or not even undocumented, just people just, anybody could be like, no, not my child, no, it's got to be something else, or just misdiagnose and be something else, and just, I mean, the whole system in America needs a total overhaul, but that's not
Yeah.
happening anytime soon. If anything, it's getting worse.
Yeah.
Um, but yeah, this is just a lot that's happening, and as more education and more, that's why we have the research and kind of try to put that in practice.
Mm-hmm. Yep. The crazy thing about like private practice is most insurances won't cover therapy for diagnoses like autism or ADHD. And so we treat mood disorders that might be co-occurring.
Mm,
And so it's tricky because we have to understand. So I don't treat ADHD, right? Because insurance will deny it, which I think is crazy town. But insurance will deny it. So I treat maybe anxiety. I might treat depression. I might treat depression that comes from like low self-esteem because maybe they've been the bad kid or whatever, right?
right.
But I have to understand ADHD if I want to apply the therapies that will help this kid, right?
Mhm.
And so sometimes we talk about in private practice, like this is the flavor of anxiety or self-esteem issues. The flavor is ADHD, right? And so I've got to help that kid. Or um, there's this little tiny town that's like half Utah and half Wendover. I mean, I'm half Nevada. It's called Wendover, and there is a lot. It's all casinos and a and then the people who work at the casino is who lives there. And when I worked out there, it's like, yeah, there was some of the cultural stuff. It's really fun. I speak enough Spanish to where like I understand when people talk to me
Okay.
and I speak back to them like a 2-year-old. And that's what my college years got me for Spanish. But we could always converse back and forth, right? But there's
Mm,
so much that can be missed in there, right? Like
absolutely.
I don't treat their like not knowing English or whatever, but I have to understand that how I apply this therapy has to meet how they're, they accept it. And so like you've brought up, like how do they like how do we talk about feelings and cultures,
Hmm.
like and it's kind of a funny setting because here I am, I'm like kind of a funny uprising in social work, but like I I was the only like I was their only option, and here I am white.
Hmm.
And they could have been really benefited by somebody who did speak Spanish, right? Like I
Yeah.
didn't have that at my disposal. And in social work courses, we're always taught like you ask the client, hey, what, like how do you experience this? Teach me about your culture. And here's my thing. Is that a little annoying?
Yes.
Wouldn't that be so nice just to have somebody that understands your culture and not have to just like, okay, let me teach you how to be my therapist, and and I mean, we do the best we can. That I was their only option, and I was
Yeah.
doing the best I can, But definitely, there is a lot that can be lost in there, and a lot that could benefit from that. Like somebody just coming in and getting it and understanding their culture,
Mm,
and how to apply therapy in a way that feels most comfortable for them. And I think they understood I was going to do my very best, and I like wanted to do it as sensitive and understanding
mm.
as I could. And really, in my clinic, I was probably the best bet. We were all like white social workers going to an area where like probably half the city speaks Spanish, and
Mm.
um, we were like in a Catholic church that was Spanish speaking only, utilizing one of their like I was in where they teach like the catechism
Okay.
classes.
Yeah.
I think that's what it was
The-
called. Anyways, utilizing that space, right? And I just think there is, yeah, there's a language to therapy, right?
mhm.
And it's not my language. It's not, as the therapist, it's not my language that's important. It's my client's language, right? Like, is it the neurodiversity? Can I speak to that? Can I make sure it speaks their language?
Right.
um or is it the cultural, like it, like for us out here in Utah, we have a predominant religion, and we have to be able to speak in and out of that. you know
Okay.
and I was just thinking, like, for kids, how you talked about in some cultures it's like, oh no, my kid's fine, whatever, not my kid or whatever. In this religious culture, often it's um we're just always, it's that positivity, we're just being positive, he'll grow out of this, or we're saying prayers, we're
Mm,
blessing this child, and it can limit the access to these therapies that have good outcomes for our kids, and
right.
there's nothing wrong with them having these disabilities,
No,
right? That
absolutely.
like it just is what it is. It's just who they are.
Yeah, it's just
um
educating the masses about that. Now, is it
yeah,
what religion is that? Is that the Mormon or some or
yeah,
something? Okay.
yeah. Church of Jesus Christ of Latter-day Saints is their name, but yeah,
Yeah, and religion definitely plays a huge role, just pretty much with anything in life, depending on how you were raised, how you grew up, where you live at,
absolutely, yeah.
and I've had clients that like the moms will be like, I'm taking my kid out to therapy. He's gonna go to church and pray whatever is going on with him and and just
Yeah,
pray that's gonna work. I'm like, no, the kid shows symptoms of ADHD, and he may
Yeah.
need medication, or just need better
Hmm.
structure in the home for you to like deal with your child. So it was
Yeah.
so
Yeah. And
it's a
maybe
lot.
sitting at church for 2 hours might be exacerbating some of those ADHD symptoms, right?
Yes. I know I can't do 2 hours at a church.
Yeah. I know
um,
it can take a toll for, yeah, I think it's so, one of the tricky things I think out here when you're working with children with religion is being really careful about not letting therapy become like weaponized.
mm,
Like if a child is being bad by the standards of this religion, like I can't fix that. You know, like if they're making choices because they don't want to go to church, or um something that pops up here is we'll have kids that identify in the LGBTQ plus community, and the parents disagree,
mm,
or may not believe that is an option or whatever. And like in therapy, it's a subtle line between conversion therapy, and trying to change that child.
mm,
And that's just not my job, right? Like it's not my job to change how people identify themselves, right? And like I've had this conversation with parents a lot, like it. Yeah, so they'll call in and have concerns about my child's identifying this way, that way, and I'll just say, so are they anxious? Are they depressed? Because that's what we treat in therapy. Like, do we have trauma? Or I'm here to help with the mood symptoms. I'm here to help them feel happy.
right.
um, and so it's really tricky because there's a few things, like if a kid is choosing to have an intimate relationship with the people that they're dating, that might not be in line with the standards of the church. And so as a therapist, a parent would want us to tell them so they can intervene. But I mean, actually, that you have to decide, right? Like, can we do that? Or like, I don't feel right intervening on how a child identifies themselves. Like, I don't even, I like, for me, I'm like, I don't want to,
That, that's
I don't want to
that's
get
where you got to
involved in
bring.
that as much,
That's where you
right?
got to bring the code
Yeah,
of ethics into it, and
there we
we
go.
can't
Yeah.
we can't really do conversion
Yeah.
therapy, and
Right.
to a point we have to explain that to parents. No, we that's not what we treat. This is what we do, and if you don't like it,
Hmm.
then maybe that's I'm not the person for you, and you have to find something else. So
Yeah. That can be really tricky because those children will identify religious trauma, right? Like if they're
mm,
going to a religion that preaches against who they are or view
mm,
who they see themselves as, So yeah, there's certain um, complications that can take place when you have, these highly religious cultures. And um, I'm not their bishop. They're like, religious stuff is not, that's not my scope of practice.
mm,
I'm here to help them with anxiety and what they deem to be trauma or traumatic for them.
right. And that's something to explain to parents. Like, listen, like whatever, I understand. Like you hear them and you try to empathize with them, but like I can't change a person. I'm not a miracle worker. I'm not. I
Yeah.
just like this is my practice. This is what I do. Like treat mood disorders, or I do
Hmm.
CBT, or do whatever like it is in private practice, or just what the agency. If you work at an agency, what do you do with it? This is what we do, and like you feel like it's not best practice for you, then but you have that right to try to
Hmm.
find something else, and that but you're going to be the one that's going to be dealing with, with the consequences of your child, and still having that you know those same issues is just I can't do that. I gotta go by my code of ethics. I
Yeah.
gotta go my licensure, my state, and follow rules regulations that got me the license in the first place, and not
Mhm.
risking. Sometimes you gotta be blunt, and be like, I'm not risking losing my license for you or my agency, and
Right.
sometimes you gotta cut those losses.
Totally. Well, and for me, it's not even in my value system because I'm like,
Mm,
I, I believe in everybody should have access to quality care.
mm,
That's not just if you're male or female or gay or straight or black or white. Like everybody should have access to quality care, right? And as a social worker, we uphold the ethics of social justice and
mm.
you know like going against discrimination. And so for me, I'm like, oh, that just wouldn't even be in my value system. Like every person. That's kind of like a rule when I hire people in my practice. Every person has to feel welcome, based on access to care, right? Like we don't discriminate based on like it, regardless of what religion we are. We don't discriminate based on somebody how they identify their social, sexual orientation or
Right.
um, cultural or well, whatever cultural things. Like we just don't. Um, However, I will say our caveat is I never want to be the I never want to be in the situation like in Wendover, right? Like I would prefer people can find the therapist that matches, what they want out of therapy. But
Yeah, so sometimes it's just the nature of the beast regarding social work. Then we just had to we're the only one there, and we figure it out. I mean, luckily it's
yeah,
2023, and there's different options to do our best to try to communicate with clients. And if you have an agency or a private practice is willing to pay for interpreter services, and there's audio, there's
hmm
different companies that do video, there's different companies that do audio, a combination of both, and there's
hmm
there's Google on the phone. There's different
right,
ways to figure out Siri, and
yes. This is
it's
where COVID improved our field, right? Is like
yeah,
you've been in practice long enough. I'm like all of the Zoom and all that. That was like not in play back in the day, right?
no,
Like, and so it's cool. I'm glad that we have so many more resources since 2020. Like we can talk across the country about social work. you know,
no, absolutely, and just for myself and the podcast, just putting the name out there, and like let people meet people, and put names and faces, and we having important conversations like this, and having multiple ways people can listen or view the content and important information that's happening, and kind of get some educational. We do way more than just therapy, and but these are conversations. These are stuff that we deal with. Doesn't matter what part of the state, what part of the country we're in. We kind of deal with similar situations. Myself having to I have a lot of Haitians that I work with, and well, I know it's a bonjour when I was like welcome, and then kind of
yeah,
use the translator for everything else, and I'm like learning how to try to pick up a couple words here and there, but
yeah,
even like Spanish, because Spanish, a lot of South American. Their Spanish is different. You use different words for myself. Being Puerto
yeah,
Rican, and we say stuff differently, or just like our dialects are different, and we still might miss a couple things, and like
yeah,
you mentioned earlier about the cultural piece, and like learning disorders and stuff, but there's also like learning disorders is almost like hereditary. Like you have like the parents going through it, and you're not sure if it's a learning disability or just because many people only may have like a second, third grade education, and they're adults,
yeah,
and like you can't really. It's hard to tell whether they have a learning or they just really don't know because they don't have the education, and now they have kids, and now you try to figure out whether it's a language issue, is like a learning disabilities, like how do you like try to rule stuff out and try to provide good adequate care for the kiddos. So it's
Yeah.
a lot of factors.
Yeah. There's so many factors. Like I was just thinking about when you're working with kids, you're working with the family, right? You're working with the
Hmm.
parents. And I even felt it going through with the exploring and diagnosing process with my daughter, like so much emotion as the parent. And so like, I use EMDR with my with kids, but I also use TFCBT with kids. And at the end, they share their story. Like they have written their story, they have a narrative, they share it. And we have to coach parents to be like, hey, your job is to not cry. Your job is to not like melt down, have reactions. Like, I know this is hard stuff. Your job is to just sit and listen and just be so excited for that kid who is so excited they're feeling better and completing, and like that's part of their graduation, right?
Mm.
And so all my friends are social workers and we get on Marco Polo together and it is like our own therapy session, right? And I remember having a tough day with my daughter. I got on with my friend who is Genius and also my co-founder of Education Empowered. And she said to me, she goes, something to think about is what are you afraid this says about you as a parent? So the fact that my child is struggling,
Mm.
what are you afraid of that says about you as a parent? And you know what? There was even things like with that child, I had postpartum depression, like super bad compared. I
Mm.
didn't have it with my other child. And so I was already wrapped up in that cycle of like, I've got to make it up to this kid, but now she's struggling, right? Like that guilt
Mm.
that we get as parents when our kids struggles, this stuff comes up too. And we're asking you to be a co-regulator with that child. That this is a 5-year old that doesn't know how to regulate, and they need somebody to be an anchor for them to show them how to do that. So what if so I always tell people one of the hardest conversations I have as a children's therapist, and especially in these therapies with trauma, is telling a parent like, hey, you might need therapy, without being like rude or like coming
Right.
off like I'm being unfeeling towards them. But
Right.
having a child that's struggling with any of these things can be so difficult. And these parents and even me, like, I benefited from having therapy myself to work on the triggers that came up watching my child struggle.
Mm.
And like even yesterday was a hard day for her. She was struggling, and I found myself struggling. Like we were both crying at one point. And it hurts my heart so much to see my child struggle. And inadvertently, because of stigma that's out there, when our children have these labels or these diagnoses, it does bring up feelings, right? Like, well, not my kid, right? Like we have
Yeah.
those defense mechanisms. And so therapy with a child, like we need the parents, we need a co-regulator, we need
Mm.
somebody who can hold that child when they can't hold it together. We need somebody who can calmly say, like, I know this is hard right now, we're gonna keep working through this, like I am here for you, like go cry in the closet later, but I need you to be that anchor in that moment. And we're not going to be perfect ever, right? Like,
No,
sometimes
absolutely.
that's something I say to my, I'm a children's therapist. Like I know this stuff. And yet here my daughter and I are both crying, together. But I'm like I always say, I'm a human mom. I'm not a robot mom. Human moms have feelings. Human parents have feelings. Human therapists have feelings, right? And
No, absolutely.
uh, but sometimes that's like kind of a tricky part that like kicks in is, if your child has suffered, especially like a trauma, and you're hearing them talk about it in a session or like they're telling their story, oof, that can get you deep in the heart, right? To see our kids have gone through those hard things when
Mm.
we just want them to be, happy, fun, joyful kids, right?
Right.
But yeah, that's a tricky one that can that's something we practice in our consultations is how do you tell a parent that they could benefit from therapy and not damage that therapeutic relationship with them.
What are some tips, especially for MSW students or newly grads who watch or listen to the podcast? Well, like, 'Cause you could be just straight up like no, or just be like, have you ever thought about maybe having a seeing the therapist yourself, or have an
Hmm.
individual? I don't know. Depending on the context, depending how I might say it, or
Yeah.
how good my relationship is with somebody, or just like I think you need therapy. Might need the therapy session yourself, or even start with family
Yeah.
therapy and kind of like ease them in, or something like that. I mean, I haven't done therapy in a few years, but I mean that's something just off the top of my head. Might come up
Totally.
with
Yeah.
something.
Yeah. The delivery. So the more awkward and weird you are saying that, the more likely it's going to come off wrong, right? Like,
Mhm.
so I was thinking maybe, you know.
Yeah.
So for me, I always build that into psychoeducation. Like in the psychoeducation, we're telling them about what is secondary trauma and who are the secondary trauma people in this child's
Mhm.
life. Like going back to systems theory, like sometimes I'll draw that like bullseye looking thing in there, and that kid's right in the middle, and here's these secondary people who are impacted by that child's trauma. Sometimes the child is the secondary person, sometimes they're both primary people. But
Mhm.
as a parent, we are always going to have secondary trauma. Always. We're going to have vicarious trauma. Always. Like just the same way as social workers, we experience that with our clients, right?
Yes.
And so sometimes it's just part of psychoeducation. Sometimes when I'm telling them, like, hey, we're going to be doing this program. And at the end, I prep parent, at the end, they're going to tell you their story. Even if in EMDR, a lot of times we'll create, if a child is young, and sometimes I work with kids that are like in that 4 to 6 range, where like they can't just like tell you their story as straightforward as possible as maybe like a 15-year-old could, right? Or like a
Mhm.
25-year-old. And so we do write their story, or sometimes I have the parents tell me the story so we can write it up, and use that as part of their processing. And so I tell parents this can be hard. And sometimes, I think it helps that I'm also a parent, and I'm a parent of somebody with these, with difficulties. And I can say, as a parent, I know I needed the support. Um, there's this is a trick that happens. This is a pitfall, I will say, that has to be staffed. If you're an MSW student, you're going into your intern, or even if you're in your for us, there's CSWs that are still in supervision but have graduated. Is oftentimes the parents say, "Okay, can I see you?" And sometimes yes, and sometimes no. Kind of depends on the parent. A whole number of factors, but
Yeah.
consultation helps with that. Um, but I think, yeah, psychoeducation, if you can frame it in that way, that like, hey, you're experiencing something too. This isn't just you being like a bad parent or an emotional parent. Like you experienced a legit thing, and here's the name of it. People take that really well.
Mhm.
The trickier one is sometimes as sessions are going and a parent is really reactive. With young children, they're maybe not in for the whole session, but they're coming in to like tell me how things are going and what was happening. If they're kind of reactive, that could be a little more difficult, that because as they're crying on my couch, I don't want to be like, hey, remember we talked about therapy? That's good for you.
Right.
Um, but empathy goes a long way. Like, this is hard stuff. Like, you're not the only one that would look at this and feel like this is hard. This is a really, really normal reaction to dealing with hard stuff. And we all benefit from support when we're going through hard things. Um, Sometimes I'll help. I like to have this is where I think networking is so important when you're
Mhm.
in private practice or as a social worker, because maybe sometimes they need they need me to help connect to, like, hey, I have a name of somebody who could be helpful in this situation. Let me give you their information. And so yeah, I mean, that's how I approach it. I think psychoeducation in the very beginning, if your child has experienced trauma, you should probably have support, right? Because that's vicarious secondary
Yeah.
trauma. And if you look at things like the crime victim reparations, there's typically coverage for secondary victims, which is like the parents of these kids maybe that have experienced criminal acts, or witnessed those things. And so sometimes that's really easy too. That that means that they have coverage, and that's the benefit, that they'll be able to afford that,
Right.
and it wouldn't be extra cost. I mean, that's just kind of realistic, right? Like, we have to be able to afford and have access to the care as well.
No, absolutely. Which leads to kind of like a perfect segue. I know I've been on the podcast and on Twitter and all over, kind of talking about the ending of the COVID emergency, which
Yeah,
leads, and one of the main parts that is not being talked enough about is the people need to renew their Medicaid is no longer automatically renewed, and it started April of this year, and like the government completely just like just has not said anything. At least not stateside, where in
yeah,
my state, I mean, the state has gotten it together a little bit. How the rollout has been difficult, but just on the federal level is like nothing's really happening, and it's like people make it seem like it's like state by state basis. Like, no, it's a federal
yeah.
thing. This is happening nationwide. Like, I know I
Hmm.
saw Texas and Oklahoma, like thousands of people like lost their Medicaid all in one shot. So,
Yeah.
what are you seeing like in Utah?
Yeah, so this is like one of the soapboxes you can get me on. So I'll rein it in. But one of the things that's happening is, so insurances now can choose to not cover telehealth services. And
Mm,
to me, that like, I can't even believe that that's like a thing, because now now telehealth services are either not covered or they're covered at a reduced rate, which means private practice owners, we're going to lose money by like allowing telehealth. So I think that what we're going to see is less people accepting telehealth, less people having access to care. For me, the people who use telehealth the most right now is my moms who are experiencing like the perinatal mood, and they have a baby at home that it's just not, man, when you're just in the throes of those first few weeks with your baby, getting
mm,
out the door, when you have like postpartum anxiety,
mm,
and packing up the baby and breastfeeding, and oh, it's just not, we don't always have babysitters, and those are
mm,
the people who are going to suffer, right? It's like our people are, and there's really interesting research that's coming out that moms who have are experiencing the perinatal moods, like postpartum depression, anxiety, whatever, that their babies are more likely to be fussy or colicky or whatever. And you think like,
mm.
so okay, so if we want to intervene with that, because obviously we can't give therapy to like a 6-week old,
Right.
we're going to provide therapy to the moms and make sure that they have the support and the access to care that they need, but yet we're going to limit it by taking away a resource like telehealth, or we're going to take it away from people who are in rural areas that would have to drive an hour to see a social worker, or maybe don't even have a social worker that specializes in their need in their rural town, right? But we're going to take it away from those people. And
Wow.
to me, I'm like therapy is already in demand. Like, we are not
Yes.
meeting demand, you know? So now we're just going to not meet demand even more. And
That's
that
insane.
just, that killed me, that we're doing like what does it, like, I have some insurances that want to pay like 80% um of the rate for telehealth sessions. And what's frustrating is, like, I don't give people 80% effort on when we're on telehealth. They get 100% effort. They get the same therapy everybody else is getting. And there's no research to back it up. But like, why would we do that, other than now the insurances can recoup some revenue, right? By just paying a little bit less for these telehealth sessions.
That's absolutely insane. That's and I experienced. it's funny you mentioned that. Wow, like colicky, anxiety, and all that. Like I experienced all that when my first child. He was so colicky. It was not fun. So that kind of brought me back to. I didn't have that
Yeah.
issue with my second child, but my first. Oof.
Hmm.
uh,
But then you think about, like, let's say you're a mom whose husband's working, you live out of state from your family. Like most moms, what they're doing right now is they're scheduling telehealth, like while the baby's asleep, or the baby does a little bit better.
mm,
Like if you ever have that baby out in public while he or she was crying like that, there's so much stress and anxiety to
yes,
that, right?
yes, it
And so,
is.
and you know what? My In my office, you bring your kid. When we're treating these perinatal mood disorders, bring your child. Like they're like that just blows my mind because that's such a barrier for them. If it
Mm,
means just bring your child, and if it means that baby's crying, like if it means I hold a baby, like let's get you seen, right? Because we've seen women like not survive these mental health disorders after birth, you know? And like that just shouldn't be. That just shouldn't.
yeah, it's bad enough that there's not really any mandatory like treatment for moms. Like postpartum is real and is
Yeah,
scary, and that just leads, especially for women who have C-sections, and then
totally.
you might get hooked on prescription pain pills because you're in a lot of pain and you're dealing with a
Mm-hmm.
newborn, and that leads to anxiety, leads to depression, and who knows. You have a good support system, so how there's not mandatory in the U.S. that at least some sort of short term treatment, like aftercare. There's aftercare when in foster care when the kids
Yeah,
go back home on like child discharge, or they get back
yeah,
home with their natural parents, and there's aftercare service. What can be like aftercare for moms? You just provide that additional support, and that sure I wish I had that. Um,
well,
at least for the for my son.
yeah,
I went through a lot with my first child. So and then afterwards with my second child as well. But um, just a lot of stuff that this country does is just as backwards, for lack of a better word. And you have
mm-hmm.
all these insurance companies is keep raking money. Blue Cross Blue Shield is like a conglomerate. Got
Yes, I
United
know.
United Healthcare is like one of the top companies in terms of stocks in the United States. So it's like
Yep,
insane that they're profiting all these money and then they want to cut services, or you got to fight tooth and nail
right.
to get stuff paid. Is ridiculous.
Yep,
I see
yeah.
why
I know that.
private practice. That's
Yes,
why they take. You gotta have cash, otherwise I'm not seeing you.
yeah. I know some people, I think, and I know, like you see it on Twitter, right? Like clinicians will get hate if they want to move towards cash pay, like that they're
Mhm,
greedy or whatever, right? And sometimes it's like, oh, yeah, it, insurance companies control so much when they're in as part of the practice.
mhm,
Um, and in my practice, I accept insurance. I work with insurance because I just want it. I just want people to be able to come to therapy, right? But on the back end, that does mean a lot of headaches, a lot of fighting with
mhm.
insurances, a lot of like taking a hit on the telehealth. Um, yeah, and it God, it just shouldn't be like that, right? Like what? Like what? I don't
No, it should really
understand.
shouldn't. Especially we fought so much to we've come so far in terms of therapy the last 3 years in terms of
Yeah.
Zoom and getting it HIPAA regulated, or there's
Yep.
other things besides Zoom that therapists are using, and for billable purposes, and to
Hmm.
have insurance be like, no, I'm not, we're not paying for treatment, then it's like you're kind of, I don't know. It's just, it doesn't make any sense at all.
Yeah, no, it is true that it is. Here's where, a kicker with children's therapy is there's certain diagnoses that you would want to use with child, like adjustment disorder. Adjustment disorder is super common if a child is experiencing like divorce with their parents or whatever.
Mm,
Insurances won't pay for that. So there's a dilemma, right? Like, is that the only diagnosis that works for that child, or that child just doesn't have access to therapy? Like it, and it's like, well, I don't understand, right? Like I'd rather intervene when it's an adjustment disorder
mm,
versus now we're moving into like their first episode of depression, you
right.
know, and now insurance will pay for it. And it's like, and who suffers? Who suffers from that, right? That child that,
Yeah.
like, I wish it's hard for parents. Like, we're out there working hard, right? And we want to provide as much as we can for our kids. But to pay, cash for therapy sessions can just be out of reach for some parents, probably
No.
most parents, if I'm being honest, right? And
Mm, right.
that's not because they're bad parents. And so there are things like that, like we talked about ADHD. I can't treat ADHD. And so I have to be really careful that, like, if I'm suggesting things, that they're not ADHD interventions, they are mood disorder interventions. Otherwise, it can be denied by insurance. And so that's just not even with the research, right? Like in all the meta-analyses of ADHD in children, it's like medication and therapy had the best outcomes. So why are we not providing therapy? And it's because insurances won't allow it. They won't pay for it. And why are insurances deciding that versus like the professionals in the field?
Right. Uh, It's it's a lot.
Yeah.
That's that it really doesn't make any sense, and that's what people, and I see why, like, people just, the more of a push for, like, macro work, and like everything else
Yeah.
that don't want to do clinical, because they just don't want to be bothered with, just hearing people's story. Could be like you mentioned, vicarious trauma earlier, and I spent a lot of time talking about vicarious trauma on the podcast, especially 2020 and stuff like that. And like, people
Yeah.
just don't want to deal with insurances, and just rather do other things in social work, or learn and just do passion projects, and with their mixed in with their social work skills, and do entrepreneurship, and doing different things. It's just, and then sometimes it's just not worth it. And at the same time, the mental health crisis is at an all-time high. But it's just, this is part of the reasons why therapists don't want to people don't want to get into therapy, because they got to deal with all this stuff.
Yeah. I know we always talk about pay with social workers, but I kind of always think about, like, okay, so we went through 2020. I don't know about you, but I never stopped seeing clients ever.
No, me either.
Like, on the day that so in Utah it was totally crazy. On the day that, like, was the first shutdown day, I want to say it was like March 15th. We had an earthquake that morning,
Oh, wow.
just to like add to it all, right? So then all of my clients are like extra amped, right? Because not only was, like, that was our first day that everything was shut down in Utah, but we had an earthquake, and it, like,
That's
that's not
unheard
a
of.
common occurrence for us, right? Like, I mean, it does happen, but we don't typically feel them or whatever. And I was just thinking, we fought through that as social workers and therapists. And, I had no training on how to give therapy via telehealth or like EMDR. I had no training on that. So we're scrambling to learn, we're scrambling to catch up because, like, I wanted to be there for my clients through this hard time when I didn't even know what was going on, right? And sometimes I'm like, maybe I'll sound like a whiny social worker when I say this, but there's always like discounts for educators. There's always discounts for like first
Hmm.
responders. Never is anyone like, hey, 20% off for social workers in the month of social worker, social work month in
Right.
March or whatever. And I'm like, God, that's why, you know, you see that meme floating around, like, what do people think social workers do? And it's like take people's children,
Right.
and like I don't think people realize like there's no like public acknowledgement or like gratitude um for the emotional toll it takes to be a social worker.
No,
Like
absolutely.
I just think of people ask me like what, like they talk about hearing the stories all day long must be so hard, and I'm like, those stories aren't the hardest because I say, hey, you know what, I'm trained to help with that. Like trauma, great, I'm trained to help with that. It's when you get hit with these things that like I can't change that. you know that's kind of what's draining. I have this ritual, so I'll share this with everybody. This is a tip from me. I call it screaming into the void. Once a month I send emails to like the governor and whatever, just so like it's like my journaling, just to get it off my chest, like, hey, FYI, I emailed last month about telehealth, and just so you're aware, when you're creating these like suicide prevention initiatives, that like, protecting telehealth services would probably be a big boost to that. Or
Absolutely.
and so I just like scream into the void. I don't get anything back from anybody, but like, I feel like, all right, I did my job. Like, because sometimes it's really helpless. Like we're really helpless. Like I can recognize the systemic problems, but I can't change it by myself, right? Or I'm not in a power place to make the change. And that's what beats social workers down, right? Like we're trained to like see it and be able to advocate. And then when it just doesn't change it, and that's what gets to me. I don't know about you, but that's the stuff that like really gets to me.
Yeah, I mean, there's a lot of things. There's a few things that would like kind of get to me. That it's like things that I can't control. That like it's just stuff that's happening. Like mentioned several times on the podcast about losing clients during COVID and having too many condolence phone calls to make, and follow-ups in the hospital or emails that clients passing away like throughout the day every day was not fun whatsoever. And it's just a lot. And changing jobs multiple times the last 3 years, and um due to probably no fault of my own. Just stuff happens, and I talked about that on the podcast. But from doing home visits and seeing clients, and I've always said like we're the unsung heroes of our communities. I'll always put us equal or above police officers and firefighters, just because we try to prevent stuff from happening, and then if necessary we get police involved, if necessary, if those type of roles that we work in, deem appropriate for. Um, so yeah, so I'm always gonna back up, social work. We do so much, and all over the country, all over the world, and we and yeah. So I mean, we're probably never going to get the recognition from that. It's funny you mentioned recognition, and before we hit the record button, I mentioned Utah Jazz with basketball. But I remember when the Lakers won their championship, I think it was 2009, and Ron Artest, who was on the team, Meta World Peace, and he shouted out his psychiatrist in front of the world. It was like, yes, somebody acknowledges the mental
Yeah.
health professional, and it's like it's so needed. And I know there's like sports psychologists, that's the thing now, and And there's so much stuff that's happening within the sports social work now. So it's like all that plays in. So yeah, we're everywhere, and that you could think of can or
Yep.
do not think of, and we got to put ourselves. I always stress that we got to put ourselves in situations in places that we're not normally in. Which is why I go like to like financial conferences and things of that nature. Because I
Yep.
haven't, and I was like, I'm a social worker and I do this. And be like, oh, I always got like, oh, snap. So it's like,
Yeah.
so it's important to people see us and kind of acknowledge us what we do, and we gotta put our respect in our name.
Yes, totally. I was just I while you were talking, I was thinking about when you're a social worker and you work in the jails. Have you ever worked in the jail setting?
No, I've done
Cool.
visits
Awesome.
at a jail a
Yeah.
couple times. I've
In the
taken kids seeing their parents in jail.
Yeah. A social worker in a jail setting, man, I was a crisis worker, would get called in, and I they, like, let me in the jail cell. Here I was, like, totally unarmed. I can't be armed, right? Because I haven't done post. Like, I was just thinking of, like, man, that's the stuff they don't tell you, right? That, like, as a social worker, like, yeah, you're just gonna be let in.
Yeah,
And, like, the guards, they're not gonna be there without they're gonna be armed, right? Because
right.
they're like, "I'm not going in without being armed," but you know what? The social worker, you can go in there and do your assessment. So I'm like, I'm totally with you. I'm like, man, at law enforcement, at hospitals, like at schools, like there's social workers all over, but nobody, it's like, and yet nobody knows what we do, you know?
But sometimes it can be hard to explain what we do because we do so much, and it's like
Yeah.
I could just tell you what the role that I'm currently at and what I do. Am I currently role,
Yep.
but and then but I could do this, I could do this, and it's just giving people those type of options because I still struggle
Yeah.
sometimes. But what does social worker do? Like, even my own kids are like, "What do you do?" It's like, "Well,
Yeah.
do this." And like, all right, that sounds boring. They're like, all right, but like, I help people. That's the whole main idea.
Yep. Well, down to, right?
Yeah. Where could people find you at?
Yeah. So I have a profile, and you can follow me on Instagram at Mountainside Counseling Services. I don't sell anything on there. I just like to put out videos of just like tips, therapy tips, or whatever. Just good information. I don't know. I felt internet's a funny place. It can be used for good or evil, right? Let's try to put some good out there. But yeah, you can follow me at Instagram, Mountainside Counseling Services.
Yeah, just it's it's funny with social media. Like, obviously we connected. You know, you know, through the Twitter machine, whatever
Hmm.
whatever it wants to be called, but it is definitely there's a lot of more good than bad out there, especially if you kind of focus on stuff. That's what
Yeah.
Twitter has a mute button and has an
Yep.
unfollow
They have a
button, like
block
a
button. And
block, like it has all this stuff that so all this negativity for me, I don't really see it. Like see it
yeah.
occasionally, but not to the extent people always complain about it, like all this stuff. And I mean, Elon's going to do whatever Elon's going to do.
That's true.
And he should be focusing on Tesla, but
Yeah, that's
yes,
yes. And I mean, I guess if people want to follow along, I've got some. I'm working on writing some books about invisible disabilities, and that's what is it, Miss MS Social Welfare on Twitter. But
oh
they're two
nice.
different. But that's where I found you, was Miss Social Welfare. But yeah, I'm like,
Yeah.
my Twitter feed is all Utah Jazz, and out here the big rivalry in college is University of Utah versus BYU.
That's big. Yes.
And if I follow my husband, that means it clogs up my feed with BYU stuff. So even though I'm an Arizona State alum, so that will always have Arizona will always have my heart.
uh, I want to apologize for all my Laker tweets that you that you may that you may see. So
I actually feel like people should apologize to you with how the Lakers have been lately, but maybe it'll go better this season. Who knows?
hopefully, I mean, I'm
What do you
still.
what do you think? How long do you think LeBron stays on the Lakers? Do you think he's going to be there till his kid plays?
I, I'm I'm trying to advocate for him to be traded.
Oh, are you?
Him and Anthony Davis both.
Oh, both of them. They can go as a pair,
Yeah,
right?
yes. I try to trade him for Damian Lillard. Like, go to Portland.
There you go. Yeah, we haven't seen where he's going to end up, have we?
Or I'm willing to do a whole a tear down and restart all over again.
That's what, yeah, that's what Utah
Rebuild,
Jazz went
rebuild.
through. Yep. Yeah. I
It's
mean, can you even believe the Utah Jazz got rid of like what their two superstars and
well, COVID messed it up because Rudy want to
that is
spread
true.
COVID to everybody without a care in the world, and once he did the whole microphone thing,
Yeah.
that was the end of him.
Yep. Definitely. Yeah, that soured that team. We always say, so we had Joe Ingles there, right? Our
Yes.
Australian player, and they traded him, and man, like the the locker room tanked. It seemed like after like he was probably the social worker of that team,
Probably.
like he like got everyone's side of the story and talked everyone through everything. But
I'll gladly take Jordan Clarkson back on my Lakers.
oh, I
I
bet.
miss him.
Oh, I know that. I don't Jazz. I don't. The fans aren't going to let go of him. That's for sure.
He's probably the star of the team now because everybody else is gone.
I think he is. Yeah. No, I think you're right. He is definitely. Um, there's a fantastic video of this just clueless reporter stopped him on the street and asked him if he'd been into any Jazz games this season. Oh man, if you haven't seen that video, you have to watch it. That poor reporter, but like it just like won over all the fans. We all just love Jordan Clarkson so much.
On that note,